So it's my great pleasure now to invite Dr. Susan Weeks, who is the Vice Provost at Texas Christian University, the Executive Director of Health Innovation Institute, and has been a member of JBIC for at least 15 years.
Thank you. I think the at least 15 years means I'm old, right? I like to say seasoned, but old may be better, more descriptive. So thank you so much for being a part of this session. We have 5 amazing panelists who are going to help us think through this. And so I challenge each of you to think about what's one takeaway that you can have from this session that might change how you think about partnership and engagement, or that maybe is something you want to try in your own local context. So to begin, I would like to ask each of my colleagues, you've each participated in various networks and you wear multiple hats across different entities. So if you could each please introduce yourself, the entity that you are representing, and tell us a little bit about the collaborative evidence networks in which you participate. And do you mind to go first? Yes. Thanks.
So good afternoon, everyone. I'm Dr. Kavita Kachroo. I'm Deputy Director, Kalam Institute of Health Technology, leading JBI affiliated group at Kalam Institute of Health Technology, which is also a WHO collaborating center for health innovations, and that is only institute across the globe, which is a WHO collaborating center for innovations. And we are hosting world's first innovation forum at Visakhapatnam during these 3 days. So I was scheduled to be there, but due to this conference overlap, I came to Adelaide.
Was it the wine center that got you here, or?
So it's an amazing motivation, and what I see in this room is magic. It's not less than magic. And we are talking about collaborations. Collaboration is a buzzword these days, and it holds immense potential. I'll go back to Professor Zoe's morning remarks that opportunity knocks the door once. That the same statement was told to us by Dr. Jitendra Sharma when COVID hit it first time. And we all were amazed. We transferred that opportunity, adversity into an opportunity by creating an ecosystem in 347 days where we were able to manufacture oxygen concentrators, COVID diagnostic kits, PPE kits. We supplied not only in India but across the globe, wherever there was a need. So we transferred an adversity into an opportunity. And being a WHO collaborating center, we have other collaborations as well, University of Wollongong and ISPOR networks. So all these networking, collaborations, they helped us to reach out to millions. If there wasn't a collaboration, I wouldn't have been standing here and talking to you and sharing my experience. So that is a potential in collaboration.
Great. Thank you.
Howdy, everybody. I'm glad Zoe likes the Texan accent, because here we go. So I'm Drew Riddle. I'm the director of our Center for Translational Research and a colleague of Susan's at TCU in Fort Worth, Texas. And I'm also the chair of the Cochrane US network. And so, as you know, Cochrane has for a long time had centers that were headquartered similarly to the way perhaps some of our JBI centers within an institution, or whether it's academic, health systems based, et cetera. And several years ago, the Cochrane US network, which was headquartered in Baltimore at Johns Hopkins in the Bloomberg School of Public Health, dissolved because of a couple different reasons. And there was really some struggle within the network within Cochrane and the US side. And through really Susan's leadership and guidance and mentorship, we were able to create an entire network within the U.S. of Cochrane-affiliated centers. And so now there's 32 official Cochrane groups working together and then independently within the U.S. And I have the pleasure of leading that organization on the U.S. side. For us, it's been a really incredible opportunity, having been a JBI center for a number of years and being newer to the Cochrane collaboration, to see the stark similarities and clear differences between the two organizations. And I think Bianca said it earlier, we've really been trying to be almost a mediator. That doesn't sound right. It sounds like people are competing, but to bridge the gap of, in particular around resource and resource waste. And it harkens back to some of the data that Bianca presented earlier around methodology and methodology development, and add a lot of the work that you do, and I know you work with others outside of JBI, and instead of these individual silos, let's co-create together. So that's a little bit about what we do. We'll talk more about, we have some funding, and it's been an exciting time.
Great, thank you. Hello.
Yes, hello everyone. My name is Heidi Parisod and I come from Finland, so let's try the Finnish accent at this point. So I'm the new director of our national organization, which is the Nursing Research Foundation, and what we do in Finland is we promote evidence-based nursing and produce clinical guidelines for nursing in Finland. And beside this national role, we are also the host of the Finnish JBI Center. And besides that, we are also the WHO Collaborating Center for Nursing. And in these three roles, what we do, we promote evidence-based nursing and also midwifery from a bit different perspectives. So we are doing a lot from different perspectives, but I think this all gives synergy. It helps going forward in these different roles and putting different pieces together. Yeah.
Thank you.
Okay, excellent. Hello, everyone. How are you? All cool? Okay, that's great. Well, first of all, thank you, Susan and Drew, that you came with this idea for this session. And thank you, JBI, that you allowed this. And I think this is actually showing how JBI is open, to discuss this, because in the collaborations I'm involved, this is the first time we're actually discussing it with the director. So I think important to mention. When you got this question, I thought, well, okay, let's tell our story, but we have an expert for storytelling here next to me, so I will let this to Patrick. But really, our story, it's, I think I can talk about this like 3 hours. I think I have like 5 minutes only. So long story short, I will start from the end. And, well, not the end, but from the current, hopefully not the end. And the current is that we built in our country something what, when we started, my dear colleague Jana, who actually funded the JBI Center with me, and JBI Center was our first, she told me, well, Miloslav, moving to national guidelines and changing the national policy will take you 50 years. It took 10, it was not 50. I wish, it would be 5, so good compromise, I would say. So at the moment, we have the National Institute for Excellence and Quality in Healthcare, which is the institute built by the Ministry of Health. And I am the head of the Method Center for this institute. And it's having underneath the guidelines, quality of care, Center of Excellence, accreditation. So actually, all which relates to quality in healthcare. And it wouldn't be possible without actually having very strong international collaboration behind us to help us to make these changes in our country. Because Czech Republic, Central in Europe, very rigid towards evidence-based medicine 12 years ago. I hope we change this, and we're still working hard to actually to change all this. So the JBI was our first one. I have a privilege to be director of our Czech Republic JBI Center of Excellence. Then 2018, and it was actually after we went to the Global Evidence Summit, the first one in South Africa. For me, by the way, the best conference I ever attended. And that time I said, well, if I ever organize some conference, it must be this one. We were lucky enough, actually, that our first bid was successful. And that's the great that I will invite you soon, all of you to Prague. Not yet, we're saving this for the last day. And yeah, so then we established the Cochrane. Then actually the great center at that time. Now it's a great network, which I'm chairing as well. And also become the organizational member of the GIN within our institute. And I'm in a founding steering committee for Evidence-Based Research Network, which is a new international organization, which was actually established thanks to the European Horizon Cost Action. And it's kind of combining all what we do. here. So yeah, those are the entities we're working with, and recently also with the WHO in terms of the contextualization and the development of the guidelines. So these are now the entities we are very actively collaborate with. I have to say thanks to JBI because it was our first one, and actually JBI introduced us to the other. And now here we are, trying the best for our country in terms of the improvement of the quality of care. Thank you.
Thank you.
Okay, thank you very much, and thank you, JBI, particularly for this session. I think this session really sets the pace for equity, diversity, and inclusion, and probably we will be coming up with some really, really thought-provoking or insights that will help this move forward. I'm Patrick Okwen, and I'm the team lead of EBHC Africa, which is a JBI-affiliated group. And we are part of Cochrane, Jean, JBI, Campbell, and the Africa Evidence Network. And what I would say is that various needs also need various resources, and that's why we find ourselves in so many collaborations. And then the next thing that I believe is that you must not be in the collaborations or within the networks to do what they do, but you could be there because of your interest or because there is a little bit of that network that you may want to take home with you. And this is the philosophy that we've used within these networks, and it's been extremely useful. I would say the networks are like money in the bank if you know how to use them. Thank you.
That's a great segue to my next question. Okay, how many of you working in your current JBI center find it challenging to keep the motivation going? Is that something that we all? So I'm thinking that your question might be how on earth or why on earth would we choose to expand what we're doing when we're having difficulty having the energy and the pace to do what we're currently doing? So let's deal with that. So I'm going to start at the other end. Patrick, what was the motivation to begin to join additional evidence networks?
So just as I said previously, you have various needs, so you go for various resources. For example, our needs are beyond just clinical practice. We also have needs around policy. But even more important is the huge gap between knowledge of clinicians and patients. So we found ourselves in a situation where we rolled out an audit and feedback intervention in the treatment of malaria, and it increased the knowledge asymmetry between the clinicians and the policymakers. So it meant that we needed something more than just audits and feedback, something to reach out to the patients, to let them understand that this is where the evidence is coming from and this is where we need. And that kind of resource we may not be able to find within JBI. There were also other things around not worrying too much about duplication or not worrying too much about what is available within this resource, because it may be available in the other resource. Policy, for example, is a far objective within JBI. So, but you can get approaches for policy within like the Africa Evidence Network. So this is how we found interest in moving here and there. JBI, for example, it's hard to access the resources because they are still behind paywalls. But Cochrane, for example, the resources are available for free. So this is also an opportunity. So different networks, different opportunities. Thank you.
Great, thank you. Miloslav.
All right, excellent. I think, Patrick, your last one, I will start there. It's really different collaborations, different opportunities, and we kind of find a way how they actually are, in a synthesis altogether. And for me, one of the very important topic and one of the important theme we have on a Global Evidence Summit is the power of synergy. And that's exactly what actually we were seeking. And for our main goal to actually change the national policy, to establish the National Guideline Institute, it was really that we thought, well, okay, we need a lot of the support, to change something in a very stubborn country like is our country. You need really strong advocation from all sides. So that was the motivation actually why we said, well, this is great, and also the desire to learning new things. Yeah, with the different networks and collaboration coming, all interesting and new things, and the ways how they look to the same issue from the different perspectives, which is great, and that's where I see the synergy. And perhaps one of the message for all of you would like to submit your abstracts and workshops for Global Variant Summit. We're seeking to see this, in really the power of synergy. So synergical workshops, method workshops for effectiveness reviews, network meta-analysis, qualitative stuff, all this, we will be seeking to see this. So thank you, that's the motivation.
So before Heidi responds, I'll just have to say this really is actually just about him recruiting. That's really all this is about. So, okay, Heidi.
Yeah, thank you. So we have really similar reasons why we have been taking part in these networks. So one of the reasons is just to give the ideas, the information, what's happening within evidence-based healthcare, and keeping us up to date, and then transferring this information also to our national role. And one other thing is, because here is lots of people who knows lots on different things, so the collaboration is one key thing. So once we know who to contact, what's happening in different countries, if we are, for example, planning some international projects or something like that, that helps a lot when you know people from different countries. But also this advocation is one thing, because our national organization, the main funder is the Finnish government, and we have to every year fight for the funding and for our resources. So once we are taking part in these different networks, we think that the politicians also see us more valuable for the national purpose as well. And for example, when we are talking with the politicians and trying to explain why we need these different resources, what has helped us is the JBI, the evidence-based healthcare model. So we have something to show them that we need resources for all these different steps in order that we can have evidence-based nursing in Finland. So that's one example that has helped us. And from the WHO perspective is that we have to renew our contract every 4 years with the WHO. And once we have succeeded this process, they will send a letter to the Ministry of Social Affairs and Health in Finland and to the officers, and they tell that how important work we are doing with WHO and how valuable we are. So I think that's also something that helps us maybe to give the funding from the government year after year.
For us, the motivation was sort of twofold initially. The first was, I think Craig actually mentioned it this morning when he was talking about some of the research that's going to be and it has been embedded into some of the ongoing work. And it was the fact that there were identified gaps in where where as a JBI center alone without an additional affiliation or an additional organization, perhaps we either weren't able to fill the gaps or maybe weren't able to be at the table to be part of the conversation around the gap filling, whether that's in terms of resources. The US system is very different in the way a lot of healthcare is funded. I don't know if anyone's seen anything about the US healthcare system, but it's a bit broken perhaps. And so funding for us looks very different. There's very little, if any, governmental funding for some of the work that we do in this regard in the US. And so that was the second piece of the motivation, was positioning our center to be able to procure external funding for sustainability. Because, I mean, let's face it, at the end of the day, this work is amazing and wonderful, and a lot of us do this work in kind and for free, but that's not a sustainable model for the long term. So filling in the gaps and being able to be at the table where maybe we wouldn't have otherwise, and then funding for us were the two driving factors initially.
Thank you.
Thank you. So what I bring to the table is a practical scenario. What all we are talking about today on collaborations, we've already done it and it is there. It's an existing model there. Right now we are trying to talk about it, but I invite you all to, anyway we are coming to India, I invite you all to visit our center where you can see this model has been translated and implemented on ground, serving millions. Coming back to collaboration, having a collaboration with WHO, that we were able to save lives. So during COVID, there was a call from Somalia. They didn't had electricity in their healthcare centers. So there was a call that we need to develop an oxygen concentrator with solar energy. So we immediately put our resources together and we were able to deliver and we were able to save lives at the end. But that was only possible when we had a collaboration and we had different centers, dedicated centers for technology. One is for biomolecules, one is for medical devices, another is for clinical trials, another is building an evidence around all these innovations, process modifications and everything. So that is an immense potential. That is a model where we can show what was the result of this collaboration and what all we are able to achieve now. So I was told to be a part of this panel at the end. Actually, I wanted to show you all this. That actually makes a difference, what all I'm talking, because it's very difficult to understand when I'm just explaining you that we have this, we have that. So I wish if I had some more time, I could have, run you all through this beautiful journey, what all we have achieved because of collaborations. Thank you.
And that's another great segue. And we're going to change order so that, we keep the panel on their toes. Okay, so Drew, you're going to have to go next, or go first on the next question. And by the way, I'm changing the order of the questions, so keeping y'all sharp, right? Okay. So pick out one something that you've been able to accomplish in this multi-collaboration context that you're extremely proud of.
For us, I'm proud of the fact that we secured a fairly large grant with a combination of our center as representing JBI, Cochrane, which is many of the individuals. Vivian Welch is on the grant from the Campbell collaboration as well. Unpacking racial health equity as it relates to evidence syntheses. And we've finished our first year of work and are likely going to be funded again for another several years of work. And I think what's going to be born out of that, be on the lookout in Journal of Clinical Epidemiology. We have our series coming out probably mid-2024 now. It's with the publishers, with the editors, you know how that goes. And really understanding how we account for or perhaps don't account for racial inequity specifically in evidence syntheses as those go on to then get developed into clinical practice guidelines, best practice information sheets, et cetera. And I'm really, really proud of the fact that so much of the JBI methodology and model has been infused into that work where otherwise it would not have been at all. So I think it's really been a tremendous opportunity to share between JBI, Cochrane, and Campbell in particular in this work around this methodology.
Great. Okay, so Drew, do you want to go to your left or your right?
Wow. Let's go that way.
Okay.
One thing, maybe together when we're working with WHO, our role is maybe a bit different than in these other networks because WHO, they are really interested about how to make nursing more evidence-based, but our role there is more to give the support to WHO. And maybe, I don't know, one thing, but what we are proud of is that we have been able to give this support to WHO in helping other countries to make nursing more evidence-based. And for example, they have asked us to evaluate nursing curricula, that how this evidence-based practice has been involved in these curricula and how to make them stronger to promote nursing education in different countries. And also what we have done, we have written a booklet about how to improve evidence-based nursing and midwifery in the European region. So maybe these are a few examples that we are quite proud of.
Thank you.
Okay, I think all of you know the answer. No? You know, it's a Global Evidence Summit here in Prague.
And specifically the call for abstracts, right?
No, it's really one of the really most important projects which in front of us, and believing that this will really have a huge impact on our country, but Central Europe, where not necessarily the evidence-based approach is where it should be. Yeah, speaking about the countries around us, and we believe that this will be very strong advocation and impact which will have on the work we do. So that's definitely one, and I think it was really brilliant idea in 2016 to actually make this project which continues, and I'm very glad that even the COVID-19 came. We decided to postpone it, and then we postponed again. And I said, no, we need to, and if I need to postpone it one more time, I will do it because, it will happen in 2024. No postponements, but yeah. So, that's exciting. And of course, then Nick, as I spoke about, it's something where actually we use the fruits from all the collaboration and combine it in one institute.
Thank you. Patrick.
Okay, thank you. So I'm sure many of us in the room are familiar with the consort equity. However, maybe not so many of us will be familiar with strobe equity, because strobe equity is actually still in process of being developed. And it's possible that there are some of us in this room that are part of this working group that's developing strobe equity. Probably what you may not be aware of was that this concept or the thought for looking into a strobe equity actually came from EBHC Africa in Cameroon. And this was because we were looking at reports from observational studies, and we thought that they were kind of not very competitive with those that had used the consort equity. So we reached out to the networks, and we don't have the capacity or the funding to invest in this kind of study. So we reached out to the network, Cochrane, Campbell, specifically we reached out to Vivian Welch, and we were able to set up a working group that started work on strobe equity. And we will use these resources once it is developed. So this is a concrete example of how you can reach out to a network with something which otherwise would not have been possible without the networks. Thank you.
Great. All right, your turn.
Thank you. So imagine if we have a pathway where what all evidence is being generated in JBI directly goes to WHO or directly goes to different federal governments where they can make it applicable to on ground. See the immense potential in that. So that's what is my suggestion. Why not we work around that? We create a channel where we know, okay, we have developed the evidence which is credible, which everybody knows that, there is no doubt that it's not a credible evidence summary or a policy brief, which can be directly applied to federal governments or WHO so that it gets implemented across the globe. In addition to that, imagine a potential where if we have a page in JBI website where we all centers put our information what is happening across the globe, we need not to reach out to 100 centers, we can reach out to JBI website and everything is there, which is catering to everybody's need. If we are doing any event, we publish that there. So that's how I see a magical collaboration, and that's how we were able to make a difference.
Great.
Also in our settings.
Good, thank you. Okay, Heidi, you're going to be up next first on this. Does that make sense? Next first? Okay, you're first to answer the next question. Okay, so participating in any collaborative experience, it can have challenges. So participating in multiple evidence networks might have even more challenge. So how have you managed from a workload, from a coordination, how have you managed that?
Thank you, that's a good question. And especially because we are a really small organization in Finland, we have only like 5 researchers and 1 director and 1 assistant. But within JBI Center, we are like collaborating with different national organizations, so we are not alone in that. So that's helping us. But the other perspective is that we are focusing on each 3 roles to the same agenda, is how to promote evidence-based nursing and evidence-based healthcare. So I think that's one thing that helps us, because we can use the information from one side to help the other one, and so that's maybe the key thing that helps us to move forward.
Great. Miloslav.
All right, so how we cope with it? Well, I don't sleep. I know, it's just joke. I sleep 3 hours. Yeah. Anyway, no, it's really, the challenge is interesting because, you know, in the end, all organizations at some point will go through some challenges, yeah? When we joined Cochrane, you know, it was very rich organization with very solid funding and all, right? And suddenly then, you know, they went through quite challenges and issues need to overcome, which now are on a very good path, I would say, from what we've seen and heard with a new CEO in a place. And I remember we also went through some challenges here in JBI, yeah? Remembering as now the Singapore meeting, and I see that Zoe would like to forget about it, I understand, yeah? But I think important experiences, yeah, for all of us to see, well, which are the ways we should go, which are not the ways we should go, and I was very glad that we were able to overcome it. And actually, having this experience from one collaboration entities, bringing them to another one, so actually now these experiences are kind of helping solutions, because, you know, if we see something work out somewhere else, it should work in another collaboration as well. So that's how I see it. It's rather the benefit, actually, seeing how they can overcome the challenges. And when we started the evidence-based research network, the colleagues, because they knew we are collaborating with a lot of entities, asking, well, could you please do the analysis for us to know what are the business models and what are the challenges, opportunities, how all they work. And it was quite interesting for myself, actually, to go through all the structures and evaluate it. So, yeah, really, it's kind of, I still see the synergy, yeah? So the synergy is a way how to overcome the challenges.
Great. Thank you. Patrick.
Okay, so on my part, I think I will start by saying that networks actually remove challenges. So, of course, that also comes with its challenges, because if you are on many networks, you now have to be able to spread yourself out, to be at the different conferences, to also provide reports to the different networks, because you don't just go there to grab, you also go there to give. It's a two-way thing. So one of our biggest challenges was staffing. And I think it's a challenge that we are still not able to beat. We keep adapting, we keep learning. And for example, we have used a lot of resources within JBI, but being able to keep track or keep pace with what's expected in terms of reports has been quite challenging. And one of the approaches has been really engaging or getting other team members, new team members, younger team members who have energy to be able to work on this. And in one of them, we have actually been having some discussions with Bianca about getting one of our team members really trained, because she has been very active in the evidence-based healthcare. We organize the biggest events in Africa, and moving this forward is only possible if her capacity is built. And this cuts across different networks. And the staffing also goes with budgeting. You also need a bigger budget if you have to travel to these conferences, especially if the conferences are not funding your trip out there. So these are all considerations that we have, and we are finding different ways to beat them, but it's not so easy to beat them at this point. Thank you.
Mm-hmm. Kavita.
Thank you. So I really see that a challenge. That is actually a challenge. Human resource, we really can't, at some moment we have lots of projects in hand, but we don't have human resources who can work on it and deliver on time. So sometimes we need to let go the projects also. But at the same time, I see the equal opportunity, and I will explain this with an example. So we submitted a protocol in Prospero, And I got an email from somewhere, some person in Egypt, he really wants to work on that protocol, can you let me know, whatever it is. So I needed human resource. I just got an email out of somewhere. People are, filtering Prospero or what, that I don't know. But then I agreed to it and said, okay, if you have some extra hours, you put into it, and we were able to deliver that project. So similarly, I see the immense potential in this room. So if anybody is open for putting some extra hours in different projects, they'll gain experience, they'll gain expertise, and we'll get the human resource. That is what is the potential in collaboration, and that's how I see to it. Definitely it is a problem, but yes, we can find a solution also for it.
Great, thank you. Drew.
I echo a bit of what Patrick said around, I think for me and our center, our biggest challenge are the various requirements for reporting to KPIs, outputs, et cetera, to each of the individual entities. And where something may count on the JBI matrix, it doesn't give us any credit or standing with Cochrane, or what may give credit and standing with Cochrane is not recognized within the JBI matrix. And when you're in a time and money pressure, right? We all have limited time and limited money to do our work. Then it does require, unfortunately, at least for me, and I haven't figured out how to do this better, and if you have suggestions, let me know, where you do have to make some decisions on, well, I can't do this because this other entity's KPI or reporting structure requires that I do something else, and there's only so many hours and so many, so much available currency to do that. So for me, at least, that's been the biggest challenge, is trying to carefully weave our work together so that it's recognized as important by all of the collaborating groups. And that's not to imply that we don't feel our work is important or valued, but that it doesn't fit nicely in some sort of reporting scheme or reporting metric that's available. So to the extent, I know Bianca, you had mentioned we're coming up on maybe looking at the JBI matrix over the next few years, and so to the extent that we collectively can think about how we collaborate well with recognition and appropriate, points or whatever metric we're using to give that work value as it relates to important outputs that need to occur from Cochrane, Jen, Campbell, JBI, et cetera. So that's been our challenge.
Great, thank you. Okay, Miloslav, you're up first next. I don't know a good way to say that, but anyway, okay. So when you think about the survey that Bianca just shared the results, and we had the benefit of seeing those results a little bit earlier, what are ways that you think JBI as an organization or the JBIC as a collaborative could contribute to successful collaboration across collaborative evidence networks?
Okay, thank you. I think the JBI is already doing it. This session is an example of it, I would say. So more of these sessions, I think, would be important for the future. The first Global Evidence Summit, the JBI Gin Conference, the second Global Evidence Summit, World Evidence-Based Healthcare Day. I think, those are all very good examples, and also what we've seen in the first session that actually is a JBI was putting up the grant to see how these collaborative entities can actually collaboratively approach towards the SDGs. That's something what I see is going on here. So I would just say, let's continue.
From my perspective, I think just like Miloslav said, a lot of this is already being done. You have the JBI Clinical Fellowship, the leadership program, which is really promoting leadership, clinical practice, and evidence-based leadership within the African community and other Asian communities. You also have the comprehensive systematic review that's already engaging quite a lot of people across the board. But I think one aspect that really needs to be pushed forward within the perspective of equity, diversity, and inclusion is a consideration on the fees to accessing the resources of JBI. It's not like zero fees, but what it means when maybe Zoe can pay $57 for a paper and I have to also pay $57, it means that following a purchasing power parity, I am paying 5 times more than Zoe. So these are some considerations. I know we are not talking to JBI on this, but up to the publishers, but it's, at least this is the forum where I can speak about that. That's going to engage or ensure that members of the Africa Evidence Network, if I talk to them about JBI resources, they can access it. Members of maybe another ASEAN, they can also access it. So this is one of the considerations I would be making at this point. Thank you.
Kavita.
Yes, so I have a statement here. So unless and until we are able to translate the bedroom talks to boardroom talks, so we should not say that, we are effective enough. If a patient is there, he wants to get surgery done, but is he able to access the evidence? That's what was told by the previous panelists also. He is not able to access the evidence. He has to make a decision. It's not the hospital doctor who will make a decision for him. Ultimately, that decision goes to the doctor, but it is the patient who should be empowered. So, unless and until we reach to that place where bedroom talks are translated into boardroom talks, so that they feel empowered, they feel that, oh, there is an organization, there is someone credible who is developing evidence for us where they can go and have a look and decide for themselves what is good and what is bad, what is cost effective, what is clinically effective. So we need to reach out to that level where people look forward to us.
Great.
Thank you.
Thanks. Sure.
I think there's a lot of opportunity around methods and methodology. And, I've been involved with JBI for years, and it was sort of funny. I was actually talking to Sue Salmon and Lisa Hopp over lunch and thinking, we used to come to these meetings, what new methodology is it going to be this year? You remember? Like, it's like, oh, there's another one, and here's another one, and here's another. And the reality is, JBI has some fantastic methodology, but doesn't necessarily have to be the leading expert on every single methodologic possibility. Rather, take the lead on those that are really within our wheelhouse at JBI and collaborate with others where it's really within their wheelhouse, be it Campbell or Cochrane or Gin or fill in the blank of which opportunity. I think the inclusive nature of JBI from the onset really positions JBI to be the leader of helping those collaborations and community of methodological science development be the lead. Not that they have to develop the methodology, but that the inclusive nature of the way JBI's function can help play matchmaker maybe a little bit and help some of those relationships and then foster and encourage the development. So I think there's room there rather than duplication of methodological development and support in silos kind of across. And I know that it's already being done some, but I think there's a lot of opportunity to grow that.
Heidi.
Yeah, I think there is already a lot what has been done, but if I look from the WHO perspective, maybe WHO hasn't been involved in that much in the collaboration with JBI so far, at least what I know. And they are really interested, for example, within the nursing and midwifery, that how to make nursing more stronger and more evidence-based. So I think making more closely collaboration with WHO, maybe providing some training or something to those who are interested about how to make things better. So maybe that could be one opportunity that JBI could do. And maybe inviting members of WHO to the Global Evidence Summit as well could be one option.
They are invited.
Did anyone know there's a Global Evidence Summit? I have a really just a quick, raise your hand if you personally are a nurse, if that's your background. Look around the room for a second, y'all. There's a bunch of us here. There really is, I think, a strong impetus in nursing and evidence-based nursing practice, and I know that's not in any way to exclude colleagues from any of the other health disciplines, but the power of nursing in this room is pretty impactful.
Great. Okay, so we have 13 minutes left for this session. I'm going to give Patrick an opportunity to answer a question first, and we're going to go this way down the panel. And then I hope we'll have time and some questions from our audience. I have more questions, but I really want to hear what's on your mind. So if you have a question, get ready. You'll have an opportunity soon. So Patrick, and then Miloslav on down, what are some gaps that are not currently being filled by any evidence network that you think is worth us having on our radar?
So I think I'll tell you a story, and we will be, good thing is we've been invited to the Global Evidence Summit to come and tell stories. So we will be there to tell a lot of stories. So I'll tell you a story about a review on intermittent fasting, which we have been able to make reach over 10,000 people, and we have lots of feedback. And this is a systematic review from JBI by Harris. I think this was done in 2016. And this systematic review is about the effectiveness of intermittent fasting compared to continuous fasting, and also compared to no intervention at all. And it's interesting because this systematic review speaks to us as researchers, as clinicians, as practitioners, but it doesn't speak to the citizens or to the population about how they could use it, because it's locked behind complex scientific language. So we developed a number of stories, short stories that go on for about 2 minutes, but which are able to integrate the forest plots, the grade tables that are within that systematic reviews, and then we tell them in short stories, and we spread them out on Facebook, on WhatsApp, and in local languages. So people are able to reach or listen to these stories and understand based on behavior change techniques that have been developed on the taxonomies. I think currently we have about 98 different taxonomies. So we focus on different one of these. We use a systematic approach to reach out to them. I think that was because we found a gap in the systematic reviews that were developed. Most of them were targeting practitioners, researchers, and sometimes policymakers, completely leaving out those who actually need research, who are the public or the populations or the citizens. So that's the gap I believe we should look at as well. Thank you.
Great, thank you. Miloslav.
That's a very interesting question. Well, I think we don't need more international organizations. We need the one which will be effectively connecting all we have. Yeah, because sometimes it's happening, and I see it now. Again, mentioning Global Evidence Summit, learning a lot from this experience, truly. Because there is many, great networks who are, and we even don't know they exist until we find them. And I think really that what we perhaps need in this is really some harmonization and able to find where are the strengths of each of these collaborations and kind of combine them or have some umbrella organization which would work this way. There are many examples what we found. The COVID-19 took us quite a lot of things, but also gave us something. And I was myself involved in several amazing projects. One of the most impactful from my perspective was the COVID-19 map of recommendations. There were entities from around the globe, all which we represent, but also many other which I didn't know before, working collaboratively, actually getting all existing guidelines for COVID-19 under one roof, under one platform. It was a really great project led by Professor Holger Schönemann, which I believe most of you know. And yeah, that was great to see how quickly we were able to actually, work together without money in the first place, and actually then make it sustainable thanks to the grants. But yeah, so it will be perhaps some umbrella where we should be able to identify where are our strengths and weaknesses to work collaboratively, strongly together.
And the umbrella looks just like the Global Evidence Summit diagram, right?
I didn't want to say it, but thank
Yeah,
you.
yeah. Heidi.
Yeah, I'll continue from that. I might be a bit idealistic, but there are many global problems within the healthcare. There is the shortage of healthcare staff, mental health issues, retention, and so forth. So maybe this kind of umbrella could help us put the resources together to find evidence-based answers to these challenges and make our politicians in different countries to understand that what is the best solution to overcome these challenges. So maybe that kind of umbrella would be something that would help us working together to solve these big problems.
True.
I don't know that any of the various entities engage with the end users as well as we should. And often it's the production of the evidence and then it's a push situation, right? Here it is, here's what you need to do. And I know many of us I remember sessions over the years here at various JBI events where we've had a novel approach to participant engagement, stakeholder engagement, knowledge user, end user, there's a million terms. We can't even really define who we're talking about well. But we don't do, in my assessment, across any of the networks, a good enough job engaging those that are ultimately impacted by the work that we produce. And I think there's a tremendous opportunity with the expertise of everybody in this room and elsewhere to figure that out. It's not an easy solution, I don't think, but so incredibly important.
Great. Kavita.
Yeah, I'll continue with that. So, working with government, I get an opportunity to travel a lot. So once I traveled to a periphery Indian village. There we do an audit how policies were translated on ground. Were they translated or if there was any disruption in the policy translation. So we met many villagers and we took their interviews. So what came out from that interview was, when I asked them, were you able to benefit from this package? They said, no, we don't like it. I said, why? We have done lots of hard work developing this for you. But then she said, nobody asked me what I want. Imagine, we're not reaching to people, we're not reaching to patients, what exactly they want. So what are we doing? Where we are not, involving them for policy decisions. That's how we turned the table, and that's how we, now modified the way of working. We reach out to them, we take a feedback from them, and then we develop something for them. So it's very important. And as far as how we are able to contribute and how we should do that is matchmaking. JBI should do this perfect matchmaking as we are here, so that, the proper translation, and there is a way to reach out to different networks. Where we have already established networks, we need not to do anything for them. Right now, they are well established in their ecosystem. The only thing is we need to connect. That's what. Thank you.
Okay, so we have 5 minutes till the alarm on my phone goes off, and then there are magic doors that we all fall down underneath this thing. So what questions have come up in your mind? Yes. A microphone is coming.
Thank you. Very nice panel, and we really enjoyed. And I have a question from panelists and you. If there is any study that shows that this collaboration between WHO, JBI, Cochrane, had any add-on benefit to improve evidence synthesis, even evidence implementation or not. And if there's no study in this regard, I recommend to have such a study to tell everyone, all our organizations, we might have some collaboration with each other, because these persons in panelists are persons not the, the representative of JBI or WHO, because they are very active. They're working in different entities. Okay, and I don't know if there is any evidence for this collaboration. And one more comment about JBI, because JBI is very unique in evidence implementation part, and we need to have some collaboration with clinical networks, like different associations for different disease or global disease, and we have to introduce the evidence implementation and this strategy to clinicians and the user of these evidence synthesis, I think.
So I mentioned earlier that the panelists were like giving me perfect segues, and you've given a perfect segue. Bianca, do you want to talk a little bit about what you're thinking? Or? Right. Okay. However, I think Bianca has some ideas about this. Do you want to come up and say?
All I was going to say is I think that will lead into the next session when we do talk about the proposed changes for clinical partnership engagement. But certainly I think all of these sorts of questions are what we want you to bring into the survey and discussion next year. So when we talk about the operational and governance framework for the JBIC in terms of meeting the needs of the members, I think that these are exactly the sorts of issues that we want to say, okay, within our governance and operational model, how do we meet that need if it's not currently being met? And listen, it might not be through an activity, it might be through a commitment statement at the beginning, so there are other avenues for that. And so all I would say is bring that into the discussion next year, because I think that's a key part of what we're trying to achieve.
Thank you, Bianca. Okay, we have 2 minutes left. Does anyone have a short question? I've intimidated you. Oh, okay, Craig.
All right, I want to just see what your reaction is to a comment, because in JBI and a lot of other organisations, we talk about evidence-based healthcare as being the bringing together of the needs, values and preferences of the individual patient with the best available evidence and clinical expertise in order to improve health services delivery. If someone said to you, transitioning away from the focus on improving clinical practice toward end-user engagement is indicative of a failure of evidence-based practice, what would you say?
If moving away from that were
so if you transition the mission, for example, to focus more on end users, is that a tacit acknowledgement that evidence-based practice has failed?
No.
Justify your reaction, please.
No. My gut says no. I think it's the natural progression next steps, and perhaps an identification that there has been a piece that's been missing, and it's important to include, and not exclusive of the other stuff you mentioned.
Yes, and I would just add to what Drew said. I would say it's adaptive learning.
Yeah.
So we started with practice, then we see that it's working. But as I earlier mentioned, this could actually increase the knowledge asymmetry. So you now need to also think about the other end users. So you learn from that, then you move on. Thank you.
So I'm going to, my timer has gone off, so I'm going to bring us to a close. One of our colleagues this morning, I think it was Craig, you talked about Donna Bedian, was that you? So think about Donna Bedian. He talks about structure, process, outcome. What I'd like to add to that is the idea of impact. So we can have outcomes, but what has been the true impact of these outcomes? And I think for what I see in this growing collaboration between the collaborative evidence networks is the ability for us to meet that goal of evidence-based healthcare really in a more broad way, and not just meet the specific outcomes for each organization, but truly create the global impact that we're all after. So please join me in thanking our panelists.
And a big thank